Okay. Hi, I'm Sachi, and I'm a student in Dr. Jill McKee's research group. She was rewarded a grant, a C grant from the KCNT1 Epilepsy Foundation to uh, delineate the longitudinal phenotypes of KCNT1 related disorders. Oops. So how do we go about looking at these clinical features of individuals with KCNT1 over time? We first use data from our local cohort and citizen health data. We assigned HPO terms, performed computational analyses, and then rebuilt the clinical histories of individuals with KCNT1. So what is HPO, or the Human Phenotype Ontology? It's essentially this big dictionary filled with thousands of different clinical terms to describe individuals. So on the left is the full HPO with 30,000 clinical features, and on the right is a smaller subset. So you can see here that absence seizures and focal impaired awareness seizure are a lot closer than, say, ataxia and absence seizures, for example. We had 57 individuals in our cohort with missense variants. We did combine data with regards to individuals with ADNFLE and EIMFS. However, in the future, we would want to separate this. 54 out of 57 individuals had seizures. There was a high frequency of issues with the digestive system, neurodevelopmental delay, and so forth. On the right is the genetic landscape of individuals with KCNT1 in our cohort. You can see three recurrent variants, 288, 474, and 934, across two different domains of KCNT1. So we then created a longitudinal view to see the phenotypic variation of individuals with KCNT1. There's a total of 705 unique phenotypic terms and a total of 341 patient years. So how do these clinical features appear over time, or these specific clinical features appear over time? You can see that there is a relative abundance of red across these different terms, meaning that many individuals experience these clinical features at least one point in their lifetime or throughout their life. If we just focus on seizures and issues with the respiratory system, we can see that there's a lot more red with regards to seizures, meaning that most individuals had seizures throughout their life. If we look at issues of the respiratory system, you can see that there's a higher prominence earlier in life, and you can see that these issues kind of resolve later on in life. We know that individuals at KCNT1 do have delays. However, we really wanted to measure and quantify these developmental milestones. So if we take the use of verbal communication, for example, we can see that 35 out of the total 57 individuals were tested for this milestone, and 8 out of 35 individuals attained the use of verbal communication. So if you look on the left, and you follow this maroon line, you can see that 75%, or 3/4 of these individuals who did attain the use of verbal communication attained this by around 5 years. So really measuring and quantifying these developmental milestones can aid with clinical trial readiness. We then plotted a figure to see the cumulative seizure onset of individuals with KCNT1. You can see that 85% of individuals start having seizures by 1 year of age, as denoted by the red dashed line. But how do we look at the specific seizure occurrence and intensity of these seizures of these individuals? So this plot, each line shows an individual and their respective seizure history. You can see that there's a lot of dark red. This means that a lot of these individuals, or most of these individuals, had over 5 seizures per day, or many seizures per day, especially earlier in their lifetime. You can see with these gray lines that some individuals did maintain seizure freedom for some period of time. So for our next steps, we'd want to investigate the longitudinal genotype-phenotype correlations, delineate the longitudinal seizure trajectories, and then assess the effectiveness of anti-seizure medications. And this is our team. So you have Jan Jagielski on the right. He's our data scientist. Lisha Harrison is our genetic counselor. And then Dr. Jill McKee is our PI. So thank you to the KCNT1 Epilepsy Foundation, Citizen Health, the Hellbook Lab, and the Children's Hospital of Philadelphia.
That is really great work, and thanks so much for presenting this today. Just a suggestion would be it would be really helpful to have each of those outputs broken down by phenotype, just because it can be hard to it can be a little bit confusing seeing that and seeing like the number of patients that walk and talk overall, because presumably most of those patients that walk and talk are going to be SHE patients. But it would be really just kind of interesting to report that by phenotype.
Yes, that makes sense. We'll do that in the future, but yes, thank you.